So the first mention of the Nordea paper is made in this report written by Chris Bateman, published in February, South African Medical Journal, February 2013. And it's a report about the debate that I had with Professor Rousseau. Professor Rousseau was going to be one of the expert witnesses for the complainant. And when I read through this, obviously I've read it many times because these people are very critical of me, extremely critical, so critical that borders on defamation. So these are not my friends who wrote this. And this is the final paragraph. And this, it said, according to the UCT professors Stein and Levitt, the Cochrane collaboration of the Medical Research Council is due to release a formal review of all the existing data on the subject by the end of February 2013. So there's the February 2013. This is the Nordea study. And so you have to ask, what did Stein and Levitt know about it? What did Professor Rousseau know about it? What's that got to do? Where did that all come from? Why were they interested in this paper? And the answer is this paper was drawn up because these people were angry with what I was saying about heart disease and cholesterol. That's what this debate was about. It was not about infant nutrition. It was about diets that may cause cholesterol to go up and cause heart disease. It was the diet-heart hypothesis. That's what we debated. And that is why the meta-analysis was put in place. And so here we see there's a train leaving the station wanting to attack Noakes on the diet-heart hypothesis. And they put together a meta-analysis which is going to prove that the low-carbohydrate diet is dangerous. But that train gets derailed somewhere. And I know why it gets derailed, because those people are beginning to realize the diet-heart hypothesis is nonsense. And we have two expert witnesses who are going to come and show that it is nonsense. And they're not prepared to come and give evidence because they know they'll get torn apart. So now this train, which has been derailed, it suddenly jumps train and becomes something to do with weaning diets and breastfeeding. But the study was never set up. The meta-analysis was never set up to address the issue of weaning. It was set up to address the question or to attack me on the diet-heart hypothesis. Part of the reason why I heard about this study coming, and I said, but it doesn't worry me. And I gave this evidence before, because at that time, in 2013, before the publication of 2014, there was a study which was a really low carbohydrate diet versus a low fat diet for long-term weight loss. And it showed that the low carbohydrate ketogenic diet outperformed the low fat diet. So I was never concerned that the Nordea paper would add anything to the debate, because the other meta-analysis done on real low carbohydrate diets had shown that the low carbohydrate diet outperformed the low fat diet. And I was frankly surprised that when we did the isoenergetic study, compared the Nordea study, that they came out that the low carbohydrate diet outperforms the low fat diet. We didn't expect that because it's isoenergetic. But you need to understand how damaging that paper is, if it is true, because conventional dietetics in South Africa teaches two things. It says all calories are equal, and it says if you eat fat, you'll get fat. And that study, that meta-analysis disproves it, because it didn't matter where the calories came from. As long as you ate the same amount of calories but from carbohydrates, you lost more weight. So the calories can't be equal. So the paper in the end becomes very, very threatening to the profession. And I just want to make the point here, and because I don't think I have a slide for it. Yes, I do have a slide for it. That's correct. So now we need to put the Nordea paper into the trial, how important it is to the trial. And so again, I went through the evidence, testimony, and Mrs. Strader made certain points during the testimony. So this is Mrs. Strader, the complainant, and she says, because everyone was going on what the evidence was saying, everybody, and the question is, who's everybody? Everybody was waiting for this publication, and this is the Nordea study, because we could not simply go ahead and make statements about Professor Noakes' hypothesis or diet. He said it's not a hypothesis, but Professor Noakes' hypothesis of diet without looking at the evidence. So everybody, and then she says, all these big organizations were waiting on the publication of this information before we could make any kind of media statement. And I would ask, this is meant to be a complaint against me from ADSA and from Mrs. Stradom. What's it got to do with these big organizations? And who's everyone? What's going on behind the scenes that we don't know about? And she continues on page 300. So this was, in any science, we expect opinion is your lowest level of evidence, i.e. my opinion is low evidence, correct? And meta-analysis would be the highest level. So remember, she's putting all her eggs into that one meta-analysis, which we've shown was wrong. So before any media statements could be made, we had to get that information and all those associations. Again, which associations and why are they interested in a case against me? What's it got to do with them? We're waiting on that. It was not like everybody joined together to now make a statement against Professor Noakes. Well, unfortunately, her testimony disputes that, because she said everyone's waiting. And then she said, no, actually we're not. We're not all ganging up. We were all waiting for the evidence to be published. So again, the question is, who's we? And who's all these associations? And what's really behind this issue? And again, I draw the attention to, these are important people. This is the Center for Evidence-Based Care at Stellenbosch University. That would be Celeste Nordea. The Division of Human Nutrition was Marianne Senekal, who was here earlier this morning as part of the complainants team. It's the South African Cochrane Center at the Stellenbosch University, and it's even the Liverpool School of Tropical Medicine. So those are the people who are involved in this analysis. These are powerful people who have huge credibility. And then she continues on page 302. I think it was a fair way in which it was handled, because we did not make any comments about Professor Noakes' diet until that point from the ADSA stand, because we wanted the evidence. We would not want to just say, oh, we do not agree with it because of nothing. We had to wait for that research to be complete, so that all these associations were waiting this information, and that is what it was. And again, it's all these associations. But the negative point is that this analysis has nothing to do with infant nutrition. So why were they waiting for an analysis which had nothing to do with infant nutrition to charge me on the basis of a tweet which supposedly said something about weaning and breastfeeding? And on page 622, Professor Foster again confirms that the meta-analysis is important. After you've done a process of selecting the quality papers, you will then do the systematic review and use the systematic review to base your recommendations on. So it will lead to the highest evidence of quality that you can get. And again, that shows why this meta-analysis done by these experts carried such weight, by showing that the senior author for that paper has recently been appointed into a new position, and as a co-director of this organization, there she is, Celeste Nordea, will lead the Cochrane Nutrition with guidance from an international advisory board. And the point is that this person, who may have made serious errors in this paper, is now being charged with the responsibility of running this Cochrane Institute. And why is that important? Because I believe she may have bias against low carbohydrate diets. And therefore, it is more probable that there will be bias presented by this organization. And the vision of Cochrane Nutrition is that Cochrane will be the independent, globally recognized go-to place for nutrition systematic reviews. Cochrane Nutrition will support and enable evidence-informed decision-making for nutrition policy and practice by advancing the production and use of high-quality, globally relevant nutrition-related Cochrane reviews. So this person will be deciding the future of nutrition in South Africa. And this organization will be determining it. And that's very important information. And I just want to now emphasize again, when this paper came out, it was used to debunk me and to again suggest this Tim Noakes is whatever. And so it says here, celebrity professor. Celebrity, well, actually I'm a scientist, I'm not a celebrity, which again shows that this lady, who comes from Stellenbosch University, although she doesn't acknowledge it, is writing as a tabloid journalist, not an investigative journalist. As soon as you use the word celebrity, that's not investigative journalism. So she says, celebrity Professor Tim Noakes' popular low-carbohydrate banting diet is neither healthier nor better for dropping kilos than a balanced weight loss diet. Now imagine if she'd had to say, Professor Tim Noakes' popular low-carbohydrate banting diet is actually better, you can lose weight more quickly than on a balanced weight loss diet. Imagine if she'd had to write that. And then, so...
Professor, the Stellenbosch University study, is that the same Nordea study?
That is the Nordea study. So we've been through that, and then she continues, and then Celeste Nordea says in public, this study shows that when the amount of energy consumed by people following the low carbohydrate and balanced diets was similar, there was no difference in weight loss. So she made that statement to the South African public, and it may or may not be true. And then there were a series of articles, again written by this lady, Wilma Stassen, also coming from this article, and it was also generally derogatory of myself and the diet. And the point I make again is that if the truth had come out, these articles could not have been published.
Now, Professor, in the course of your evidence previously and in the course of this morning, much was spoken about in respect of the national and international guidelines related to diets. Is there anything that you would want to say about that, Professor?
Yes, I would like to add that in the past few months, both the United Kingdom and Canadian authorities have come out very strongly to question the traditional or conventional dietary guidelines. And I'd like briefly to go through their evidence. So this is an organization called the National Obesity Forum, and it's not a national body, but it is a body of experts who've got together because they're tired of giving the wrong advice. And so they've produced two documents, and the one is this one, Eat Fat, Cut the Carbs, and Avoid Snacking to Reverse Obesity and Type 2 Diabetes. And I'm just going to go through and pick out the more important messages from this document. And they begin by saying that after 250,000 years of evolution, humans became a healthy, well-nourished species with a long life expectancy. But in only 30 years, things have gone catastrophically wrong with the epidemics of obesity and type 2 diabetes, unchecked by current policies and interventions likely to cause reduced life expectancy and bankruptcy of the healthcare systems. This report represents a potential shift in failed policies and recommends alternatives which are likely to reverse some of the counterproductive effects of recent policy. Solving the obesity epidemic and its associated adverse health consequences such as type 2 diabetes is today's most important public health challenge. And that, I submit, is why I'm here, is because I understand that type 2 diabetes is the most important public health challenge in the world. Just as an aside, there are 400 million people with type 2 diabetes as of today. There are 30 million people with HIV. That's the difference. It's tenfold greater than the issues of HIV. And we kind of ignore it. So, obesity directly costs the National Health Service more than $6 billion pounds per year. Directly and indirectly, type 2 diabetes costs £20 billion. And without effective action, this price is likely to double over the next 20 years. In the United States, the cost of diabetes has soared recently, reaching US dollars $245 billion in 2012. And those are frightening numbers because they're going to bankrupt not just medicine, but the nation. And this is what people are finally realizing. The roots of obesity and type 2 diabetes are firmly embedded in the food environment. And the food environment has tried to prevent that, but that reality being acknowledged, but that is the truth. Legislative efforts to encourage less consumption of processed foods and sugary drinks will help significantly reduce the burden of diet-related diseases, which now contribute to more disease and death globally than physical inactivity, smoking, and alcohol combined. The role of poor dietary advice has been ignored for too long. Specifically, the low-fat and low cholesterol message have had unintended disastrous health consequences. The flawed science behind this message and subsequent change in dietary guidelines introduced for Americans in 1977, followed by the UK Public Health Dietary Advice issued by the National Advisory Committee on National Education in 1983, and that Zoe Harcombe will address, has resulted in increased consumption of low-fat junk food, refined carbohydrates, and polyunsaturated vegetable oils. In the United States, between 1961 to 2011, 90% of the increased in-calorie intake has come from carbohydrates and polyunsaturated vegetable oils.
Madam Chair, page 710.
So that is just the outline, and then you can see in that picture, that is the new diet plate, as it were, and that is how they're suggesting we should be eating, but I'm going to indicate to you what they're actually saying. So they go back and say, these are the current UK guidelines, and those would be very similar to the South African dietary guidelines. And I'm not going to go through them because those are what's currently, and we're going to see what this public health collaboration is going to suggest we should change them for. And this is what they say, the three main areas of concern in regard to the Eat Well Guide.
Page 713, Madam Chair.
The avoidance of foods because of saturated fat content. They say you shouldn't worry about the foods necessarily because they've got some saturated fat in them. The dietary reference value of no more than 35% total fat, they disagree. They say you can eat as much fat as you like. There's no evidence that you should restrict fat intake. And we need to look at the quality and quantity of carbohydrates. In other words, we need to restrict the carbohydrate content.
Page 714, Madam Chair.
So that's just the new idea. And you'll see there are no cereals and grains on that. And our diet is based in South African dietary guidelines are the starchy carbohydrates, the refined carbohydrates, the healthy grain, the so-called healthy grains. And here they're looking at non-starchy vegetables as the main source of carbohydrate, and then lots of fats and protein and oils, and drink water and so on.